by the Speaker to the Health Committee as Vice Chair, and we will welcome him openly. And with that, we do not have yet quorum, so we will move forward as a subcommittee and hear our first bill, which will be item number 4, AB 73, Jackson Mental Health, Black Mental Health Navigator Certification. Thank you, Dr. Jackson. Proceed when you're ready.
Thank you so much, Madam Chair, committee members. We are bringing back this bill from last year, AB 73, which will require the Department of Healthcare Access and Information to create a Black Mental Health Navigator certification within the Community Health Worker Certificate Program. This bill would require the department to develop specific training and mental health resources, including crisis intervention, training for non-emergency cases, entry-level assessments, navigation support, and culturally specific practices relative to helping to connect individuals with licensed mental health professionals and wellness services. This bill would also require the department to annually gather and publish data on individuals that earn a certificate, as well as the number of people who are actively employed as community health workers as well. With me today is Tracy Stafford on behalf of the California Black Health Policy Advisory Council to speak on the impact of this bill.
Thank you. Chair Bonta and distinguished committee members, I appear before you today as the chair of the California Black Health Policy Advisory Council to express our strong support for AB 73. Our council was formed to bridge the gap between community voices and policy development. We conducted extensive stakeholder engagement with healthcare professionals, community members, nonprofits, unions, and mental health experts throughout California to identify evidence-based solutions for persistent health disparities. Despite their different priorities, all shared a common concern, the mental health crisis devastating the Black community. They spoke of loved ones suffering, and silence, of stigma preventing others from seeking help, from high rates of misdiagnosis, and of a system, after all that was exposed during the COVID years, that still fails to recognize the impact of the Black experience in America. Far from contradicting equal treatment principles, AB 73 actually promotes them by addressing documented disparities in mental health care access and quality. This bill supports equal treatment of all by ensuring Black Californians have the same opportunities to receive effective, culturally competent care that is available to others. Specialized certifications are standard practice throughout healthcare, from maternal care to geriatrics, creating a specialty focus on the specific mental health needs of the Black community follows the same evidence-based approach. Black health navigators, mental health navigators, will serve as trusted bridges trained in assessment, crisis prevention, and culturally specific practices to connect people with appropriate and effective resources. They'll help reduce stigma, navigate complex systems, and ensure care rather than waiting until there's a crisis. The program also addresses critical workforce development needs. By 2030, there'll be a 21% increase in the need for health workers, for community health workers. And AB 73 prepares California for the increased demand while delivering equal access to effective mental health outcomes for the Black community. We respectfully urge you to join the California Black Health Network, the Greater Sacramento Urban League, First Five California, the Disability League, and countless others, and vote aye on AB 73. Thank you for your consideration.
Thank you. Now we will hear any additional support. Please come forward and offer your name, organization, and position only.
Good afternoon, Lizzie Kutsona here on behalf of the California State Association of Psychiatrists in support. Thank you.
Chair, members of the committee, I'm Barbara Schmitz. I'm here on behalf of First Five California. We're in support.
Madam Chair and members, Mel Osagai for the Greater Sacramento Urban League in support.
Good afternoon, Linda Way with Western Center on Law and Poverty in support.
Good afternoon, Madam Chair and members. Malik Bynum with the County Behavioral Health Directors Association in proud support.
El Chen on behalf of Drug Policy Alliance in support. Thank you.
Liz Oseguera with the California Alliance in support. Thanks.
Symphony Barbie with Planned Parenthood Affiliates of California in support.
Thank you. Now we'll move to any witnesses, any primary witnesses in opposition. Seeing none, we'll move to any witnesses in any other Me Too's in opposition. Seeing none, I'll bring it back to the committee for any questions or comments. Well, thank you. Assembly member, you may close.
I respectfully ask for an aye vote.
Thank you so much for bringing forward this bill, Dr. Jackson. As noted in the analysis, American Psychiatric Association and other entities note that Black communities encounter barriers to mental health care, including stigma, distrust of the healthcare system, and a lack of providers who are culturally competent or from similar racial and ethnic backgrounds. I really appreciate the author bringing forward this bill. You are a champion for mental health and culturally concordant care. At that, Dr. Jackson, and this bill is certainly a step in the right direction to make sure that we are creating optional specialization to train navigators that we know are incredibly helpful, like community health workers, more specifically on mental health and wellness in our Black communities, which would help in navigators to address some of these longstanding barriers. So with that, we do not have the opportunity to bring a motion quite yet because we will get to quorum, but I will definitely be supportive of the bill at the time. Thank you. We will take bills in file order, but whoever is here gets to present. So thank you so much, Assemblymember Ortega. We are going to now move on to your bill, item number 10, AB 499, the Robert F. Kennedy Farm Workers Medical Plan. Thank you so much, Assemblymember. Feel free to begin whenever you can.
Thank you, Madam Chair and members, for allowing me to present AB 499 today. The Robert F. Kennedy Farm Worker Medical Plan provides medical benefits to about 6,000 farm workers and their families. About 4% of the plan's budget is administrative and operational overhead. 96% of the RFK plan's budget goes directly to providing medical care and benefits to its beneficiaries and their dependents. The California Endowment estimates that the plan saves the state's general fund about $1 million annually in Medi-Cal expenditures. Last year, the plan needed to deplete millions in its reserves to pay for saving the life of a farm worker's son who needed a rare stem cell transplant. Currently, the RFK plan is reimbursed by the state for claims that exceed $70,000. AB 499 simply lowers that amount to $50,000 to help keep the plan operational. This bill, however, does not raise the existing annual $3 million limit on reimbursements by the state. Today, in support of this bill is Teresa Romero, President of the United Farm Workers.
Move the bill.
When we have a quorum, we will be able to do that. Ms. Romero, thank you so much. Please go ahead.
Good afternoon, Madam Chair and committee members. Teresa Romero, President of the United Farm Workers, in support. AB 499 allows farm workers and their employers to continue contributing financially to their own health care and reduce California's Medi-Cal costs. This is particularly important when our medical plan experiences the occasional acute episode of care like we experienced most recently as Assemblywoman just mentioned, and it was a young person who needed life-saving stem cell transplant. We're pleased to have worked with Stanford University Children's Hospital and share that we were able to save this young person's life. With a medical plan as basic as ours, AB 499 helps keep the RFK farm worker medical plan functioning with a modest adjustment to the state reimbursement trigger while still maintaining the existing $3 million annual cap. The RFK medical plan is a joint labor management Taft-Hartley health plan for farm workers. The UFW and contributing agricultural employers deliver basic medical care for farm workers and their families at an affordable cost. The plan is self-insured, subject to collective bargaining agreement between the UFW and agricultural employers. And as Assemblywoman Ortega mentioned, it supports over 6,000 Californians, including approximately 2,000 children. With recent changes in California law, there is a reasonable expectation that the number of farm workers covered by UFW collective bargaining agreements will grow. That growth will increase the RFK's generated state Medi-Cal savings from the current $11 million annually. Thank you for your consideration.
Thank you, Senora Romero. We will move on now to any other witnesses in support. We'll move on to any witnesses in opposition. Seeing none, Assembly member, or I'll bring it back to the committee for any questions or comments. Thank you. Seeing no comments, I will just ask Assembly member to close.
I respectfully ask for your aye vote.
Thank
And a
you.
quorum.
Thank you so much, Assembly member, and want to just appreciate Ms. Romero for coming all this way to be able to represent the work of the United Farm Workers and this self-sustaining, self-insured plan that ensures that 6,000 Californians, largely farm workers and their children, have the ability to have affordable healthcare coverage. It is a very important program for us to be able to consider to support. And with that, I will call the roll. The motion is, oh, sorry, we have to establish quorum first. Apologies.
Bonta,
Here.
Chen, Addis, Aguiar Curry, Arambula, Carrillo, Flora, Gonzalez, Krell, Patel, Rodriguez, Sanchez, Chiavo, Sharp Collins, Stephanie.
Quorum is established, and now we will go on to vote on the item number 10, AB 499 measure. What's the motion?
AB 499 is due pass to appropriations. Bonta,
Moved by Cecilia Aguirre Curry, seconded by Arambula.
Bonta,
Aye.
Bonta I, Chen, Addis, Addis I, Aguiar Curry, Aguiar Curry I, Arambula, Arambula I, Carrillo, Carrillo I, Flora, Gonzalez, Krell, Krell I, Patel, Patel I, Rodriguez, Sanchez, Chiavo, Sharp Collins, Stephanie.
That measure is on call. Thank you so much.
Thank you.
We're going to take care of our well, yes, let's go ahead and do that. We'll go back to item number 4, AB 73, Jackson. We need a motion, motioned by Flora, seconded by Arambula. Secretary, please call the roll.
AB 73 due pass to appropriations. Bonta,
Aye.
Bonta I, Chen, Addis, Addis I, Aguiar Curry, Aguiar Curry I, Arambula, Arambula I. Carrillo, Carrillo I. Flora, Flora I. Gonzalez, Krell, Krell I. Patel, Patel I. Rodriguez, Sanchez, Chiavo, Sharp Collins, Stephanie.
We'll now move back. That measure is on call. We will move back now to item number 1, which is a vote on committee rules for the Health Committee, adoption of the Health Committee rules for 2025-26. Can I have a motion? Moved by Aguirre Curry, seconded by Flora. Secretary, please call the roll.
Motion is be adopted. Bonta,
Aye.
Bonta I. Chen, Addis, Addis I. Aguirre Curry, Aguirre Curry I. Arambula, Arambula I. Carrillo, Carrillo I. Flora, Flora I. Gonzalez, Krell, Krell I. Patel, Patel I. Rodriguez, Sanchez, Chiavo, Sharp Collins, Stephanie.
That measure for adoption of the committee rules is on call. We are going to move now to vote on consent calendar. The following bills are proposed for consent for today's hearing. Any member of the committee may remove a bill from consent. For review, we have item number 5, AB 225, Bonta. Motion is due pass to appropriations. Item number 7, AB 304, Chen. Motion is due pass to appropriations. Item number 9, AB 403, Ortega. Due pass to appropriations. Item number 11, AB 688, Mark Gonzalez. The motion is due pass to appropriations. Item number 13, AB 951, Ta. Motion is due pass to appropriations. Moved by Aguirre Curry, seconded by Flora. Secretary, please call the roll.
Bonta,
Aye.
Bonta I. Chen, Addis, Addis I. Aguirre Curry, Aguirre Curry I. Arambula, Arambula I. Carrillo, Carrillo I. Flora, Flora I. Gonzalez, Krell, Krell I. Patel, Patel I. Rodriguez, Sanchez, Chiavo, Sharp Collins, Stephanie.
That measure is on call. We'll move now to committee items because we don't have any other authors here. Oh, so sorry. There we are. Assemblymember Garcia. We'll move on to item number 12, AB 843 Garcia. Healthcare coverage and language access. Thank you, Mr. Garcia. Whenever you're ready.
Good afternoon, Madam Chair and members of the committee. Thank you for having me today to present my bill, AB 843, Safeguarding Language Access Programs. California's diversity is one of our state's greatest strengths, adding rich culture and economic prosperity.
The way it currently stands, forced labor, slavery takes precedence over rehabilitation and public safety.
Oh, by the way, while the Biden administration gives reparations to everyone but freed people, look at the billions he has run over to Ukraine.
We don't have black grocery stores because if you think about it now, just to get in that supply chain, it's almost unheard of.
They don't want the truth to get out. Okay? I don't want to know what my family did or what all these people did and all this stuff like that. Okay? Come on. You read that 500-page report.
There's this thing called white superiority and black inferiority. That mindset allows all of the behaviors that we've seen across generations, allows for the construction of these policies and practices and systems and structures that continue to oppress us. This is not a handout. This is a debt that is owed.
You know, Allensworth was like the internet of his time in 1904, 1905.
The total black population in California is about 2.6 million, and then of that, the descendants compose about 2.2 million of that. So California, with a multi-billion-dollar surplus, can absolutely afford to satisfy the international terms for reparations, beginning with compensation.
Any financial obstacle that exists that impedes the success of increasing financial prosperity needs to be dealt with and eliminated.
No matter where we've been, no matter what part of this fight we've been in, we've been harmed, and we've had harm done to us specifically.
When I got to Los Angeles, this was some of the worst segregation I'd ever seen. And remember, I'm telling you, I'm from Mississippi.
Because as you can see, I'm giving you broken history right now, you know? But I had to give it to you guys today. I said, no, I got to show them this because it's so precious and nobody really knows about it.
Black people don't have that kind of luxury. Our historically black communities have been redistricted multiple times.
Now listen, if you can't handle the TR rules, don't tune in.